Hi guys, welcome to today's video. Today's video is what are the different types of feeding tubes. So there's a lot to go over here. So first I want to say feeding tubes are a very helpful medical device for those who need them. And I am a part of the population of people on this planet that need a feeding tube in order to live. I have a feeding tube due to gastroparesis, which is paralysis of the stomach. I also have dysmotility of my intestines and stuff. So I just don't digest very quickly and I don't absorb very well. So I would just like to start that off with this. I also would like to start this video off with your doctor will know if you need a feeding tube. There are instances where you do have to advocate. I had to advocate for mine because I literally was so malnourished, it was dangerous, and I had to advocate. But I just wanted to slip that in there that it's not something you should be begging for or you should want, but it is a necessity for some people. And so I just wanted to throw that out there. So let's get started. Okay, so there are 7 different types of feeding tubes that are into the actual digestive system itself. The first one is called an OJ, which is an oral gastric tube. Typically that's in the NICU, and not a lot of people besides NICU patients have that unless there is some special reason as to why they would need an OJ. An OJ goes in the mouth, down the throat, and into the stomach. Then within that same area, there's an NG, which is a nasogastric tube, which goes in your nose, down your throat, and into your stomach. I had an NG for a while, for a couple months, and placement wasn't terrible. Let me rephrase. Once I knew how to place my own NG, it wasn't terrible. My nurse that placed my NG, that was the one I went home with, like the one that I used until I was discharged, it was kind of traumatic to say the least. But if it is done properly and it is done in a way that all measures have been taken to make sure that it is not as uncomfortable as it typically can be, then it is not terrible. NGs are typically people with NGs have maybe a swallowing disorder or something wrong with like their throat, maybe something wrong with their jaw, but not typically people don't have an NG if they have delayed gastric emptying. The reason I had an NG was because my doctor wanted to see if just getting nutrients in me would help with all of my symptoms, because she didn't believe that I had delayed gastric emptying. Newsflash, I do. So that's why I started out with an NG. Then there's something called an ND, which is a nasoduodenal tube. And this tube goes in your nose, down your throat, past your stomach, and into the first part of your small intestine, which is called your duodenum. Typically, any tube that bypasses your stomach is due to something in the stomach. It could be you had an injury in the stomach and it needs rest to heal. So they're placing an ND to give your stomach a rest, to let it heal. I have not had an ND. I've also never really met anybody with an ND, but I mean, the world is a big place. So next is an NJ. I have also had an NJ. An NJ is a nasojejunal tube. This one goes in your nose, down your throat, past your stomach, past your duodenum, and into the second part of your small intestine called your jejunum. The reason I had an NJ is because I have delayed gastric emptying, so we needed to bypass the part of my stomach, of my digestive system that was causing the most issues, and so we went into my jejunum that way I could feed and absorb all of my nutrition. So with that being said, nasal tubes are not a permanent solution. They are a temporary solution. So I had an NG for several months. I then was switched to an NJ for a month. I trialed an NJ tube for a month to make sure that I would tolerate J feedings so that I could go onto a surgical tube. There are 3 types of surgical tubes. There is a G tube, which is a gastrotomy tube, which is literally a tube in your stomach that goes straight to your stomach. Okay. Then there is a J tube, which is a jejunostomy tube. There we go. And that one goes into your abdomen and straight into the second part of your small intestine, your jejunum. And then there is something called a GJ, which is a gastrostomy jejunostomy tube, which I have. I'll show you. This is my GJ tube. Sorry, my gauze is losing it. So this is my GJ tube. It goes into my stomach, and then it has this little tail that follows all the way through into my jejunum. So the reason I have a GJ is because I was originally supposed to get a J tube placed. It's called a straight J. The reason I was supposed to get a straight J tube placed is because one of my main symptoms being throwing up and constantly throwing up, GJ tubes can flip into the stomach. That J portion that's in your jejunum can flip. A GJ can flip. So with all of my throwing up, I have a higher chance of that J portion flipping up, which I actually have had quite a lot of times has it flipped now. It's actually currently flipped right now, and we're trying to figure out the best course of action to figure all that stuff out. So love that. But typically GJs are for people who need to be able to drain and vent their stomach, which is actually, it's been a really great help to me, and it has helped me a lot in managing like my bloating, my nausea. I can drain my stomach if I've eaten something that's made me really nauseous. And so that helps quite a bit, but it does suck that my tube constantly flips. And unfortunately, I cannot, typically if you have a GJ and you are having consistent issues of it flipping, they will separate your tubes and they will do a separate G and a separate J tube. But I unfortunately am not a candidate for separate G and J tube because of my anatomy. So we just have to figure out what best course of action is. And so there's a lot of different ways that surgical tubes can be placed. So nasal tubes are almost always done awake. I know that NDs and NJs you can have sedation for. I was awake for my NJ placement. It wasn't terrible, but I had also been placing my own NGs, so I was kind of used to it at this point. But an NG, you're always awake for it. Let me rephrase. You are typically awake for it. And I say that I could place my own NG because your NG, you just have to check the pH to make sure that it is in your stomach. Whereas an ND or an NJ cannot be placed by you yourself. It has to be placed by a physician in the office so that they can do it with x-ray to ensure that its placement is correct. And then G-tube, J-tube, and GJ tube are surgical tubes, so you are asleep for that. It is a procedure. My GJ tube was placed via endoscopy. There are several different ways. I am not 100% sure on the different ways. I know it's called open GJ tube placement or open J tube placement or open G tube placement, but I'm not 100% sure. So I know that there are people here online that have had different types and that they have talked about the type of tube placement that they had. Mine was done via endoscopy. It was rough. I was in a ton of pain. I was in the hospital for 4 days with severe pain. I don't remember any of it besides the pain, which kind of sucks. But yeah. And then there's another type of feeding tube. It's not in the same category. I'm so sorry. It is a long day. It's not in like the same category, but there is some feeding tubes and they are called central lines. Central line feeding tubes are Hickmans that can go here in the chest, or PICC lines that are here in this major artery. There's also something called a midline that you can do. I believe you can do TPN or PPN in. And then there's like ports that you can get. Those I'm unfamiliar with. I had a friend that had a PICC line, but I myself have never had a central line. And so I feel like I'm not really the person to come to with that. There are several people online, on TikTok, on Instagram, here on YouTube that have had central lines that I think would be much better resource for you to listen to or look to. I just also want to talk about possibly a reason why somebody might have a feeding tube. So obviously I have a feeding tube due to gastroparesis and malabsorption. People with eating disorders can have them. Head and neck cancers that make it difficult for them to swallow may have them. I know a lot of the time people with cancer get them anyways because of chemo constantly making you throw up. You're constantly losing like all of that. So yeah, and then people with stroke or paralysis, being in a coma. Sometimes Crohn's disease will cause absorption issues, or even celiac disease can cause absorption issues, which then leads to a feeding tube to help regulate that. And so it's it really is dependent. There's a lot of cases that people would have feeding tubes. But I do want to state that just because you have gastroparesis does not mean you're automatically going to get a feeding tube. That is kind of last resort after medications, diets, stuff like that. So I have tried several different diets. I also have tried several different medications. Medications are hard with me because I tend to get the side effects. I also have POTS, so that's another thing that kicks with it. And I also have EDS, which is another thing that kicks with it. So you do not automatically get a feeding tube just because you have gastroparesis. And it's really like a last resort type thing, just like a central line is a really last resort type thing. And so it's a journey to get there. That's why I say advocate for yourself. If you are doing medication after medication and nothing is helping you and you are just deteriorating and you are like, your symptoms are terrible, unmanageable, advocate for yourself. Don't let a doctor push you around. You need to advocate for yourself because you're not getting proper care at that point. And so that is just a big thing that I'm always here for, is advocating. But I hope you guys enjoyed this video. If you have any questions, please leave a comment down below and I will gladly answer them. Make sure to subscribe so that you don't lose my channel, and make sure to hit that notification bell so that you get notified of any time I post a new video. Love you guys. Bye.
I got some color back. She thinks so too. I'm almost me again. She's almost you.